share your presentation slide.
Can you see it?
Okay.
Thank you so much, Professor Yoshikawa and Inufusa. After a beautiful talk by I'd like to focus my talk today to anti-oxidative approach to keep brain health. I'm now speaking from Tokyo to Phuket. As you know, the population of dementia is quickly increasing in the world, especially in the Eastern and Southeastern Asia, like this. So it is a big problem, not only developed countries, but also developing countries, especially in Asia. I'll show you that our dementia clinic shows Alzheimer's disease and MCI occupies 74% of our dementia clinic, followed by vascular dementia, Lewy body disease, and FTD. When we divide the patient into three groups, you can find, especially late elderly people, you may find more than almost 80% of the patients are occupied by Alzheimer's disease. So treatment of Alzheimer's disease or prevention to develop Alzheimer's disease is a big problem or big challenge for every country now. In a daily clinic, we frequently find white matter change, not only Alzheimer's, but also FTD. As you may find, post-stroke dementia is now very common in developed countries. This beautiful report from Hong Kong shows that after stroke, if the patient has amyloid deposition, the decrease of MMC cognitive function quickly decrease. In contrast, even though the patient develops a stroke, if they don't have amyloid deposition, the cognitive function keep stable. So this big difference is whether the patient carry amyloid-β deposition or not. So recent research pointed out the combination of amyloid-β deposition and vascular change. Under this trend, we partially examine the white matter change in Alzheimer's disease in contrast to Parkinson's disease as a control. As you may find, more than 90% of Alzheimer's disease patients have white matter change. In contrast, also PD patients show more than 70% of PD showed white matter change. But big difference is this. In progress of white matter change, cognitive function quickly decrease in Alzheimer's disease in MMC or FAB, which is not clearly found in Parkinson's disease. This slide simply shows that Alzheimer's is a very sensitive type of dementia to vascular change or white matter change. When I was a medical student 40 years ago, Alzheimer's disease was very small in Japan, roughly 20% of dementia. In contrast, multi-infarct dementia dominate Japanese dementia, almost more than half. And after 20 years, which is year 2000, Alzheimer's disease population become higher and higher. And in the past, these two diseases are completely different. However, 22 years ago, year 2000, these two different diseases become close. And now, most of the Alzheimer's disease and the vascular dementia are overlapped now. This is a situation of super society like Japan. So we have to take care or take into account the vascular change of Alzheimer's disease. To solve this problem, I established Japanese Society of Vascular Society 12 years ago, and now we have 12 times annual meeting. This picture was taken 3 years ago in Tokyo. And I also established Vascular Society of Asia because vascular factor is very important for Alzheimer's disease of Asian countries. Then we have meeting from Tokyo, Hong Kong, Taipei, Kuala Lumpur, Brisbane, Nanking, Jakarta, Manila, or Korea, India. The last week we have this meeting in Kaohsiung, Taiwan. This picture was taken 3 years ago in Manila. This is a very, very popular meeting in Asian countries. The people from India, Indonesia, Taiwan, Japan, Philippines, Thailand also, Indonesia, Singapore come to this meeting. And I also organized a Vascular World Society almost seven years ago in Tokyo. As you may know, there are three major symptoms of dementia. One is cognitive decline. Second is affective problems, which is called BPSD. The third is ADL decline. These three factors are a very important aspect of dementia. Especially this affective problem. It's the topics, the patients in trouble, also the family are in trouble with this BPSD. To check, to evaluate this symptom, I originally make a Japanese BPSD score, which is also translated into English, Chinese, Malaysian, or Indonesian, Thai, even Thai language, Hindi, or Arabic versions. Anyway, currently Alzheimer is thought of totally 35 years disease. When we are diagnosed as Alzheimer's at 75 years old, we have 10 years to die. However, if you take a look at this picture, you may find we have 25 years to prevent, we have 25 years chance to prevent development of Alzheimer's disease. So to prevent Alzheimer's development, we can try vascular risk factor treatments such as hypertension, hyperlipidemia, or diabetes. Or we can improve our lifestyle, or even we can take supplement for these 25 years to prevent final development of Alzheimer's disease. For example, I may briefly show the tocotrienol, which is very common in Malaysia or Indonesia. This session I heard effectiveness of vitamin E. However, vitamin E is usually tocopherols. However, this tocotrienol is a 3-enol here, and which is very strong antioxidant than tocopherol. When we give tocotrienol to our rats, we found a small size of cerebral infarction along with a strong decline of lipid oxidative stress in this rat brain. In this picture, you may find the Malaysian team beautifully showed in stroke that they give the tocotrienol to 121 volunteer people, and they found white matter change was inhibited by tocotrienol treatment. in Malaysian population. This slide simply compare the tocopherols and tocotrienols. This is a conventional vitamin E. This is a new strong vitamin E. This is antioxidant effect is very strong, and the tocotrienol shows strong neuroprotective effect. And then let me introduce you the other very strong antioxidative mix 20X, which also reduce acute ischemic brain damage here. And 20X group beautifully shows reduction of oxidative stress and also reduce inflammatory markers after stroke. Then we apply this strong antioxidative 20X to our Alzheimer model mice. In this mice is originally developed amyloid-β in their brain. However, when we narrow the carotid artery of this mice, the amyloid deposition strongly increase here. However, when we give 20X to this Alzheimer model mice, this is beautiful reduce the deposition of amyloid plaque here. And 20X also reduce the oxidative stress and the inflammatory markers in the brain. These results show that the 20X shows strong effect to protect brain cells, especially in situation of Alzheimer pathology. Then we get into the human trials with placebo and 20X. And we recruited 59 Japanese MCI people, and we found in a half year, 20X group shows improvement of MMC cognitive function in contrast to placebo group. Also show different benefit of 20X in HDS cognitive functions. Let me summarize my talk. We have stable oxygen, molecular oxygen, and we have also stable water here. From oxygen to water, we have very unstable free radicals here. And Edaravone is now worldwide used for acute stroke and ALS. And my talk today shows that 20X also shows strong effect. The 20X may affect these sites of mechanisms. I was long being involved in oxidative stresses and oxidative neuroprotective therapies. And I originally developed Edaravone for acute stroke. Then in 20 years, I also tried Edaravone for chronic progressive ALS, and which shows positive results. So Japanese government approved this antioxidative drugs for ALS, followed by Korea, USA, now Switzerland. However, my talk today focus on chronic progressive dementia, MCI or Alzheimer, or even Parkinson's. Tocotrienol or 20X may positively show beneficial effect. This is what I want to continue to study in the future. Let me summarize my talk today. When we have oxidative stress in brain, this is noxious cycle here, inflammasome, IL-1 or A-beta depositions, which finally cause Alzheimer's disease. This noxious cycle can be stopped by polyphenols or 20X or tocotrienol. So to prevent Alzheimer's disease, we can take polyphenols or 20X from age 50 years old for 20 years or 25 years. to avoid developing Alzheimer's disease finally at 75 years. Thank you for your attention.